Got a really high yield video here for ischemic heart disease, and we're going to be also discussing some biostats. So the reason I'm using the first aid book here is because a lot of students they use first aid to study for USMLE. Now I don't want to overburden people with different resources and make their life complicated. Using one resource which is good is the key for simplicity and for getting high marks. So without further ado, let's start into this. The ischemic heart disease manifestation. So the way I really like to think about ischemia essentially means a lack of blood. Now that blood can contain oxygen, that can contain nutrition, but ischemia really means a lack of blood. Now typically angina has two main types, but there is a third one. The first one is stable angina. Now this is going to be due to secondary atherosclerosis. So this means secondary to atherosclerosis. So that's going to be just the way I like to describe stable angina is that you have a pipe, okay, and you've blocked like 70% of it, okay. That's stable angina. Unstable angina, you have like a plaque and it kind of lodges out, and then that could then occlude and lead to more complication. And the vasospastic, I like to describe it, it kind of just spasms. It kind of just moves up and down and it spasms. All right, so stable angina. This is going to be due to atherosclerosis, and it's due to 70% occlusion. And this is going to be exertional chest pain, and classic distribution be ST depression on ECGs, and it's going to be relieved by rest nitroglycerin. So as we know, it's going to be 70% occlusion. So you only have that top part open. Now, if you exercise, there's going to be more demand. So, but that blood demand cannot be met because we have this occlusion, and that's what is going to be causing that ischemia to occur, and that's what's going to be causing the ST depression. And how are we going to do this? Of course, we rest, the demand is going to decrease, or we do nitroglycerin. Now, nitroglycerin is going to be essentially a drug which decreases your preload. It vasodilates, it specifically venodilates, it venopools. So all your blood is going to be then going towards the part of the venous system, and therefore reducing that stress on your heart. Then let's come to vasospastic. It was also known as Prinzmann variant. It's secondary to coronary artery vasospasm, and this would have a different finding. It would lead to a transient ST elevation on ECG, and the risk factors here are going to be smoking, hypertension, hypocholesterolemia, and the triggers are going to be, for example, cocaine, alcohol, triptans, and it's going to be treated with calcium channel blockers, nitrates, and smoking cessation. So that's essentially you're getting nothing with inside the blood. That's what I'm trying to emphasize here. It's going to be spasms. So you can use calcium channel blockers, beta blockers, or nitrates to kind of reduce those spasms. Unstable angina, thrombosis, incomplete coronary artery occlusion, ST depression, and/or T wave inversion on ECG with no cardiac biomarker elevation, unlike no ST segment elevation MI. Increased frequency intensity of chest pain and any chest pain at rest. So stable angina on exertion, troponin levels, no elevation, fraction, none. ECG changes, none. Unstable is mild exertion and rest. And that's what really one thing that when I was once studying this was, how do I know which one is going to be the most dangerous? And that's going to be unstable angina, because we never know when we're going to have it. It's just unstable. It just happens at any time. And essentially, stable angina is going to be because we know if we're going to climb stairs, we're going to get exertion and we're going to get occlusion. But unstable angina, that's not the case over here. And there's going to be no troponin levels, and there's going to be no infraction, possibly ST depression or TB inversion. Now we're getting into the difficult parts, and that's going to be NSTEMI and STEMI. That's going to be essentially when we're going to be getting really big amount of necrosis to the to your muscle. So when we get necrosis to the muscle, you're going to be reducing markers. So that's going to be cardiac biomarkers, and that's really a defining feature of NSTEMI, which they say where it's elevated. And the key point over here, that's me sub endocardial. So there's me ST depression, and there's me STEMI, and at rest is me elevated and ST elevations. So guys, now as a part of a teacher, I really like to keep this interactive. So I'm going to ask you some questions. What are two ways stable angina can be relieved? And the correct answer is going to be rest or nitroglycerin. The next question is going to be how to treat Prinzmetal angina. That's going to be CCB, beta blockers, and nitrates. You want to relieve that stress. Next thing I'm going to ask you guys, what is going to be the ECG finding of unstable angina? That's going to be ST depression. By the way, guys, I'm going a little bit fast, but make sure to pause this video and think about those questions on your own. And the next thing I'm going to ask you, what's the defining feature of STEMI? That's going to be troponin levels. My last question for you guys is STEMI. How much part of the myocardial wall is involved? Answer is transmural. Guys, also make sure to pause the video, rewind any part, and just kind of brief everything out. Next thing is we're going to go into biostats. And people think this is quite complicated, but it's actually quite simple. T-test. The way I love to explain this is T means two means. So T means two means. So that checks the difference between two groups. So that's going to be comparing the mean blood pressure between men and women, or you can just say the mean height between men and women, the mean income between men and women, or you don't need to be men and women, you can just say mean weight between Africans and Asians. So just averages of just two averages, compare them. ANOVA is a little bit bigger. It's analysis of variance. That's going to be usually three means or more. So that's going to be, like we said before, we just said, the average blood pressure of men and women. We can just say like this: average blood pressure of Asians, Caucasians, Africans, and Europeans. So that's going to be ANOVA, because we're looking at means of different groups. Then let's come over here to Fisher exact test. So check differences between two percentages or proportional categorical numerical outcomes, and use of chi-square tests with small populations. We can see example is comparing the percentage of 20 men with 20 women with hypertension. So Fisher exact is going to be essentially, you're basically kind of looking more normal. So you're comparing it's more like you're kind of comparing like as they mentioned, percentage of men with hypertension versus percent of women with hypertension. Or you can just say like this, that you can just think about this, the percentage of men who are overweight versus percentage of women who are overweight. So you're not really comparing a number, you're rather just comparing a thing. Oh, is he overweight? Yes. So we're comparing that with how many with women. So we're really looking at like kind of yes no kind of scenario over here. Chi-square test, guys, very similar, but there's going to be a difference. So it checks the difference between two or more percentages of proportional categorical outcomes. So this is going to be comparing the proportion of three age groups who have essential hypertension. So that's going to be like basically you're going to have a large group over here. So that's going to be the chi-square is going to be basically kind of comparing three ethnic groups with hypertension. So like the same thing as Fisher exact, but that's a little bit smaller, but chi-square is a little bit bigger. So in the sense that you're kind of comparing essentially like high blood pressure between Asians, Africans, and African Americans. So you're kind of looking at those. So that's really similar here. So I just want to recap this, guys, because I know biostats is a bit difficult, but I really encourage you guys to use examples. That's really going to help you guys break it down. Okay, so T-test. T-test means two means, so the average blood pressure in males versus average blood pressure in females. ANOVA, analysis of variance, which is going to be the average blood pressure between Africans. That's going to be three or more groups. So Africans, Asians, and we can say Europeans. Fisher exact is more nomical. We're going to be using more names. We're going to be saying more yes and no. So blood pressure present in men versus blood pressure present in females. So yes or no. Then we can see over here the chi-square test is going to be three or more groups. So that's going to be comparing the blood pressure in maybe Africans, Asians, and Europeans. So we're looking at that. We're not looking at numbers. I really want to emphasize that. We're looking more at, do you have high blood pressure or you do not have high blood pressure? So guys, these were the two topics: ischemic heart disease, and that was also a statistical test. I want to encourage you guys to do questions. Questions is going to make this whole process really smooth. I would like to say ischemic heart disease is very high yield for USMLE. They love asking cardio question. Statistical test is high yield. It's not that high yield. I have seen some NBME question on this, but I still do recommend to maybe focus on some other parts of biostat as well. So hope you found this video. Thank you for watching. Hope to see you guys next time.